Have you ever had a friend or family member who was difficult to understand when they would talk to you, maybe after a stroke or even a serious injury? Well, that surprisingly common problem has a name, aphasia. In fact, according to the CDC, more than 200,000 people in the U.S. are diagnosed every year. That's why neurologist Dr. KJ Uman is here today to help us better understand this side effect. Thanks so much for joining us.
You're welcome.
First, let's talk about what is aphasia.
Aphasia is a special form of speech disturbance, and it's distinctly different from what we call dysarthria. These are the two major speech disorders that we encounter in the neurological practice.
And I feel that most of the time when you hear someone who has aphasia, it's because of a stroke.
Most of them are caused by stroke, and as you know, 800,000 people in the United States will have a stroke every year. So it's a major public health problem. People who have strokes are the ones that are more likely to have, or I should say that's the most common cause of aphasia and dysarthria. And the two differ in the sense that in dysarthria, the speech problem is peripheral, or is due to injury or damage to one of the nerves that control the speech apparatus, which is the tongue, the face, the lips, and the vocal cords. Whereas an aphasia is the result of damage to the brain itself, which is the computer that generates speech.
So with aphasia, there can also be a variety of the severity of it as well, can't there?
There are different types of aphasia. The most common types are what we call the Broca's aphasia, named after the person who described it. And then there is Wernicke's aphasia. And there are a couple of other minor types of aphasia, such as conduction aphasia and dysnomia. Or the last one, the most devastating one, is the global aphasia, which is components of all the different types of aphasias.
So is there any hope in getting that speech back after you've lost it?
Well, thankfully, the vast majority of aphasias are produced and dysarthrias are caused by strokes. And the prognosis is the prognosis of stroke. And as you know, stroke has a good prognosis as long as the patient is taken care of properly and appropriately and taken care of through that critical period of stroke, which is the first few days.
And so would that be with speech therapy?
Yes. Speech therapy is about all we have to offer those patients. Thankfully, they all get better by themselves, and speech therapists are a great help.
Wonderful. Thank you so much for helping us understand this. Thanks so much for being with us, Dr.
You're
Uman.
very welcome.
And stay with us. We'll be right back.